What do you see are some 3, 4, maybe 5 things that people could like recognize themselves in those patterns and maybe do something about it?
Sure. The first thing I encourage people to do is look in the mirror and look generally, step back as though you're looking at someone other than yourself. And then stand in front of the mirror, and this works great at a big mirror, like at a gym or something, and then look at your shoulders. First thing we want to do is look at, are they equal? That's so easy to see. Then look up and look at your head and look at the shape of the head and the neck and say, is my neck and head vertical? Most people are going to notice it's one side or the other, or the chin is rotated one direction or the other. And when you look at their shoulders, they're going to notice one is higher and one is lower. Super simple to do. Then the next is to put your hands on your hips, so right near your belt line, called the ilium. And then look in the mirror and see, are your hands equal? And again, most will find that they are not. So now the question becomes is, where's the force of your life going? It's not working like a pogo stick, your spine, it's working like a dish rag. But the final would be turn laterally from the side and look out of the corner of your eye and hang an imaginary string from your ear. And just look, that ear should go right over the center of your shoulder, down through the center of your hip, down through your knee, down to the ground. But most people are going to find that their head is in front of their body. It's called anterior head carriage. That means the 12-pound bowling ball is constantly in front of you, making all of the neck, shoulders, all those muscles become overused, overworked.
I understand. It all makes sense. I use different terminology, but I say very similar things to my clients all the time. I always tell them, when you walk in the room, what walks in first? Your nose, your chin, your forehead, your shoulders, or your chest?
Yep.
Don't hide your chest.
Yep.
And then people put their shoulders back. So why does your head stay forward? I always say from the side, your cheekbone should align with your clavicle. And when they do that, they say, I can't be like this. Well, because again, you conditioned yourself to be uncomfortable in a position that should be normal. So that's good advice that you gave, and you gave more details about it, that just check in the mirror how you look from the side and adjust it accordingly, right?
Correct.
Any other advice?
Sure, is check in with your symptoms. So the body's natural state is to be healthy. It's our actions and our behaviors, whether they be conscious or unconscious, are what keep us either healthy or sick. So the first question we have to look at is, what's my physical structure? And we'll probably talk more about this. The next is, what's my nutritional, chemical, and hormonal function? That means, what am I putting into my body? What's my body doing in response to the things in my life? That's where hormones come in. And then finally, what's the mental function? What goes on between my ears? So we can all know that if we're feeling downtrodden, how we hold our body is different. If we're happy, we hold our body different. We have to understand that those 3 components are adding stress to our life, or they're reducing stress. So if we don't address all 3 of those, then you're only hitting a little piece of the puzzle.
I see it in my clients every day as well. You can tell if a person had a good day or a bad day by them just entering my fitness studio. I can tell. Where are the ears? Are they close to, are you wearing your shoulders as earrings, or are you nice, tall, and proud? And you can tell definitely.